Here at Cook County, we serve a diverse patient population, including immigrant population, populations with lower socioeconomic income, a lot of minority populations, and these are the patients that are affected mostly by systemic racism. You can see how systemic racism, segregation, forcing patient populations or a certain group of people into a particular neighborhood, robbing that neighborhood or keeping that neighborhood from getting resources, can fuel violence in that neighborhood, can fuel a sense of disinvestment in that neighborhood, and all of that can affect mental health. With this code comes power. And although a lot of us don't see it that way, honestly, a lot of the public sector trusts health professionals, given the knowledge that they have and given the research that health professionals perform. I think that health professionals can do more as far as advocating for our patients, make sure health policy is appropriate for our patients, and making sure our patients' healthcare is just and fair. The most outright and overt racist thing that I experienced during my medical training was that I went to a hospital, which I won't name, as a rotating medical student on my OB-GYN service. There was a sign posted on one of the patient's doors that said, "No blacks allowed." Did not want any black physicians or black nurses involved in her care. It's depressing. It's honestly depressing that you can work your entire life to reach a point, to help people, to serve people because you care about humankind, just to be disrespected in a way that's beyond a petty insult. It's sad that you have to honestly walk around with a big sign on your chest that says supervisor for anyone to believe you and stop questioning you. It feels like your very existence is questioned. Your very utility is questioned, and it really makes you question why continue trying. But at the end of the day, you know that the more that you're doing it, the more other people see you're doing it, the more people you can encourage to do something positive with their life. I can use my life to give back to the patient population that I care about the most, that I feel like are so disadvantaged by systemic racism. That's why a lot of people work here at Cook County, because there is a particular patient population that comes here. Historically, this is the only hospital that served black patients. So to me, it's an honor to be here working amongst this patient population. And I feel like the more that I succeed and the more people that I bring behind me, the better care that our patients will get.